Hi friends, once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing important and previous year questions for nursing officer exam. If you are watching my channel first time, kindly go through my previous videos. So many questions are there. These questions will be helpful for your exam preparation. If it is useful for your studies, please subscribe my channel and support me. Also share my videos to your friend circle. Let's start today's question. Our first question: which of the following vaccine is routinely given in pregnancy? Options: Option A, influenza. Option B, tetanus. Option C, oral polio. Option D, rabies. The vaccine which is given during the time of pregnancy is tetanus or TT. Here option B is the correct answer. 2 doses of TT injections are given during the time of pregnancy. In that, first dose will give as soon as the pregnancy is confirmed, and the second dose will give at least 4 weeks after first dose. Okay. And the next question is: an 8-year-old admitted to the hospital in sickle cell crisis. Appropriate nursing care during this period include options: Option A, administer of analgesics. Option B, cold compress to painful joint. Option C, restricted fluid until crisis is over. Option D, active range of motion exercise to all joints. Here the question is: an 8-year-old child admitted in hospital with sickle cell crisis. Sickle cell crisis is the acute exacerbation of sickle cell anemia. During this period, sickle cell crisis time, the child may have painful swelling of the hand, feet, joint, and also sometimes the child may experience abdominal pain. So the first priority nursing action is to administer analgesic. Option A is the correct answer. And the next question is: which of the following does not cross the placenta? Options: Option A, heparin. Option B, naloxone. Option C, morphine. Option D, warfarin. Our question: among this option, which drug does not cross the placenta? And the correct answer is, it is option A, heparin. Move on to the next question. Sunset eyes are the features of options: Option A, dehydration. Option B, hydrocephalus. Option C, head injury. Option D, conjunctivitis. Sunset eyes are the feature of hydrocephalus. Option B is the correct answer. Move on to the next question. When feeding an 18-month-old child, 2 days after he underwent a cleft palate repair, a nurse would offer liquid nutrition using a options: Option A, plastic cup. Option B, sealated nasogastric tube. Option C, flexible straw. Option D, a rubber coated infant spoon. Here the question is: an 18-month-old child undergone cleft palate repair. So after cleft palate repair, 2 days after cleft palate repair, the nurse is providing or offering liquid nutrition to the child. In which ways or in how she can give this liquid nutrition? That is our question. She can provide this liquid through a rubber coated infant spoon. Always use soft spoon or soft sippy cup to provide liquid to the baby. Here correct answer is option D. Here the next question is: which type of diet is implicated in the development of diverticulosis? Options: Option A, low fiber diet. Option B, high fiber diet. Option C, high protein diet. Option D, low carbohydrate diet. Our question is: among this option, which type of diet can cause diverticulosis? Diverticulosis means outpouching of or small pouches which is developed in the gastrointestinal tract. Okay, so the diet which can cause the development of diverticulosis is low fiber diet. Option A is the correct answer. So in such patient, have to take high fiber diet. Okay, option here the correct answer is option A. Move on to the next question. Which of the following organism is the most common cause of early onset of neonatal conjunctivitis? Options: Option A, toxoplasmosis. Option B, chlamydia. Option C, trichomoniasis. Option D, histoplasma. The most common cause of early onset of neonatal conjunctivitis is by chlamydia. Okay, option B is the correct answer. And the next question is: a nurse is assisting a physician with the removal of a chest tube. The nurse should instruct the client to options: Option A, exhale slowly. Option B, stay very still. Option C, inhale and exhale quickly. Option D, perform the Valsalva maneuver. Here the question is, a nurse is assisting a physician for the removal of chest tube or chest drainage tube. What instruction does the nurse give to the client while removing the tube? Okay. Here we can see what we have to do while removing the chest drainage tube. When the chest tube is removed, ask to perform the Valsalva maneuver. We have to ask the client to do deep breathe, exhale and bear down. Okay, this is Valsalva maneuver. So that will come our correct answer. And during this time, the tube is quickly withdrawn and an airtight dressing is tapped in place. Okay. Another one technique also we can use. Also can ask the client to take a deep breath and hold the breath while the tube is removed. That also we can do, and Valsalva maneuver, that technique also we can perform. Okay. Here the correct answer is option D. Perform the Valsalva maneuver. Valsalva maneuver means ask the patient to take a deep breath, then exhale and bear down. During the time, we have to quickly remove the tube and put a dressing, tight dressing. Here next question. Which one of the following causes urinary incontinence? Options. Option A, metoprolol. Option B, digoxin. Option C, verapamil. Option D, theophylline. Here the question is, which drug can cause urinary incontinence? Incontinence means involuntary passage of urine. So the correct answer is option D, theophylline. Theophylline can cause urinary incontinence. Option D. Move on to the next question. Which one of the kidney stone is not visible in the X-ray? Options. Option A, calcium oxalate stone. Option B, calcium phosphate stone. Option C, Struvite stone. Option D, uric acid stone. And the correct answer is, it is option D, uric acid stone. Uric acid stones are translucent. Translucent means it is not visible in the X-ray. Option D. And the next question is, which one of the following stone is more common among women? Options. Option A, Struvite stone. Option B, uric acid stone. Option C, calcium oxalate stone. Option D, calcium phosphate stone. The correct answer is option A, Struvite stone. Due to frequent UTI, that is urinary tract infection, makes the urine alkaline. Okay, the most common alkaline stone is Struvite stone. So the stone which is most commonly seen in women is Struvite stone. Option A. Friends, today the number of questions are less. I will include more questions on the next video. Sorry for that. Continue your studies. Do revision. Practice with previous year questions.